Okay, so I'm just going to go ahead and sort of introduce myself because I don't know a lot of people here. I'm sure they don't know me either. And I'm going to talk about why I'm talking about mindfulness today because it's not something we learned in PT school, and I'm far from professionally qualified to do this. So I'm Tanvi. I did my bachelor's from DY and I graduated in 2011. No, I joined in 2011. I graduated in 2016. Yeah. And after that, I did my master's in health sciences from the University of Indianapolis. And I was working in a pediatric setup in three different places in the US for about a year and a half, year-ish. And that's when I sort of just stumbled upon by happy accident on this whole world of yoga, mindfulness, meditation, and all of that. So I started to just take yoga classes. Hi, Renita. So I started to take these yoga, started to go to these yoga classes, and that's where they had like a lot of emphasis on meditative side of yoga also. And I had a lot of anxiety at that time, which was undiagnosed. So I didn't know. I just thought something's just wrong with my wiring, right? But I found that I was finding less physical symptoms of my anxiety at that time since I started to participate in these things. So I also happened to do this continuing education course, which was about yoga and mindfulness in children. And what I tried from those courses, I tried to apply it into my practice. And we saw a lot of our ADHD kids, a lot of our autism spectrum kids who had so much difficulty self-regulating, they started to respond a little better to treatment over time. I was in the school setting, so it was easier to incorporate these in group sessions, once a week consistently. So that's when I noticed that there is something here, right? And it's working, and not just for the kids, but for me too, right? I feel more regulated after those specific sessions I took for those kids. And I started to explore more about it. I came back to India. I did a 1 month teacher training course from the Yoga Institute. And Shreya was one of the reasons I actually did that course because she had done it previously, and I was very mega inspired. So I went ahead and I did that too. And following that, I've just been reading a lot of books about it. I've been going through these Coursera courses, any kind of webinars I can find about it. And mostly whatever I do know or talk about in terms of mindfulness is coming from my personal practice of it. I have been um, not religiously practicing, but sort of on and off, being drawn to it since over a year, 2 years now. But in November this year, I was diagnosed with anxiety, depression, a whole cocktail of these mental health disorders. And that was really something. And that experience got me to just shut down. I was not doing anything. I quit everything. And I've talked about it previously with people. So my therapist, when I went there, initially it was based on sort of holding the fort down and getting someone from a completely depressed zone to a neutral affect. But as we saw some improvement, we again started to incorporate mindfulness based cognitive therapy into my sessions, and that has been life changing. Like, that has helped me more than any other intervention I did for my conditions. So whatever I am talking about is primarily based on my experiences and backed by whatever data I could find. But all the data in the field of mindfulness is it's in the stage of infancy, so it's still up and coming. Anyway, so we're going to go on and we'll just talk about what is mindfulness. And I don't want to go ahead and bombard you guys with the definition. So what I'm going to do is I want everybody to take about 10-20 seconds and just take a deep breath in and exhale and start to notice your body. So I want you to notice, what position are you sitting in? How is that position feeling to you? Are there any places in your body that are feeling tense? Are there any places in your body that are feeling relaxed? So just notice the whole experience of you sitting in front of your screens And don't try to change anything. Just observe it, right? Non-judgmental, just observing it. So those few seconds that we spent there, that's mindfulness, right? We were aware of our present moment. We were aware of our physical disposition in the present moment. We were very aware of the sensations that are arising in the present moment, and we were not going off into our wonderland, so to speak. So that, just noticing the present moment without judgment, without trying to get something out of it, without trying to label it, is what is mindfulness. So it's to sum it up, it's kind of like, this is what I'm feeling, and I'm aware of what I'm feeling, and I'm allowing myself to feel that way, and not let judgment of it or my opinion of it taint the present moment. Mostly what happens with us is our shoulds and musts really dictate things we do. So for those of you who were here for Raj's talk yesterday, I took away a great deal from it. And what really stood out to me was how he kept talking about, don't think about what the world would say. And another sort of roadblock we experience in life in terms of our emotional distress comes from these shoulds and these musts that we've created, either from society, from teachers, from parents, from friends. Log kya kahenge is a part of your shoulds and musts, and another is what you have inculcated into your own head. So when you decide one day that I'm going to quit what I'm doing and do something else entirely, the first resistance you're going to find is from your own selves, right? There's a part of you that's like, is this right? Should I do this? And it's not coming from a place of doubt as much as it's coming from a place of judgment of, is this good or bad? So mindfulness practice over time allows you to look beyond your shoulds and musts, and really start looking at your decisions a little more disconnectedly, a little more non-judgmentally, and you're able to make logic-based decisions instead of emotion-based decisions. We say mindfulness, like I talked about, it helps emotional stress a lot. And how that is happening is because emotional stress is arising from the desire to alleviate unpleasant experiences and increase pleasant experiences, right? So all of us, we want to feel good all the time. I mean, I love feeling good, and I'm not going to wish upon me or anyone else that, oh, you don't wake up saying I want to have a sucky day today. You get up and you really want to have a wonderful day, and there's nothing wrong in that. But what happens is sometimes things don't go your way, and when that happens, you immediately start to feel one unpleasant sensation after the other, until you've decided this whole day has gone to shit. Nothing good is going to come out of it. And now you're sad, or you're upset, or you're disappointed, whatever negative emotion that comes with it. We, when we feel a certain way, when a child, right, a kid is crying, he's feeling bad about it. What do we tend to say as parents, or as providers, is, don't be sad. You don't have to be sad. Don't cry. Don't feel guilty. Don't be angry. Every time a kid is angry, you're like, don't be angry. So what we're doing is we're labeling our reactions or our emotions as good or bad. And in this labeling spree that we're at it all the time. If I'm feeling something, maybe I'm feeling like with my anxiety, I used to feel a lot of fluttering sensation, right, in my whole body. Like there's this some sort of vibratory sense in a way, and I at that time was used to label it as bad. This is a bad sensation. I don't want it. Why is this happening to me? I want to escape, make this go away. But we worked on it, and then when I was in a better place, I noticed that I was getting these fluttery sensations again. And then when I noticed, it was because I was feeling good. I was getting these really fluttery sensations because I wanted to move. I wanted to maybe, jump, or wanted to run, or I was really happy, and I needed an outlet for that extra happy, joyful energy in me. And it was the same sensation. So if you take a moment to step back and just look at your experiences, your emotions, your behaviors and thoughts, not as good or bad. Don't go on this mad labeling spree, ye acha, ye ganda, ye acha, ye bura. You just go on to say, it is. And that's enough, right? So you are feeling inadequate maybe in this moment, you are feeling some doubts about what you might be doing. So you don't have to pity yourself, or you don't have to feel sad being all like, oh, I don't know what I'm going to do in the future. It's okay to take a step back and say, I am feeling doubt in this moment, and that's it. Don't throw yourself a pity party after that. Don't go ahead to analyze it, but just acknowledge it and stay with it. A lot of times when we have experiences in the past, right? So maybe I'm terrified of dogs. It's because when I was little, I was bit by a dog. So a lot of our past experiences will dictate the way we judge present experiences. So maybe Shreya and I are both walking on the street, and there's a little cute puppy approaching us, and her reaction is going to be to want to go and cuddle the puppy. But because of my past experiences, my reaction is going to be to probably run away for shelter because I'm terrified. It's not the puppy that's bad. It's not anything in the experience that's either good or bad. Her past experience has her judge the situation as a positive situation, and my past experience has me labeling it as a negative situation. So now this is where mindfulness comes into play, is when we take a step back, right? And we are not judgmental. Now I'm not looking at every emotion, thought, experience, sensation to label it as good or bad, but I am looking at it as it is. I'm trying not to judge it, I'm just experiencing it, right? That is when I am not reacting to it. That is when I am not associating any further outcomes to it. If it's a thought, I'm not going on this really nice overthinking spree about it. I'm just observing. I'm experiencing. What if it's a negative thought? I would experience, I would observe the experience it creates for me. What is the effect it has on my body? What is it doing to me? What is my heart rate high? Am I sweating? Are my palms sweaty? Am I nervous? So you start to observe and internalize all of these. And then you notice that whatever the moment, no matter how pleasant or unpleasant, it is going to pass. So you may be feeling sad about something, but what we tend to do as humans is run away from that feeling. If it's unpleasant, we don't want it. If it's, I'm going to tell you, I'm going to poke you with needles, you're going to run away from me the minute you see me holding a needle. But maybe I'm holding a cupcake, you're going to run towards me. And what mindfulness is saying, don't judge a cupcake as good or a needle as bad, but approach everything with a very neutral sort of mindset, and just experience it for what it is, and know that whatever the experience, it's going to do things to you mentally, emotionally, physically. It's going to create an experience for you, but it's going to also pass when it's done. And that comes in very handy when you're dealing with very intense emotions, when you're dealing with a lot of maybe pain or grief or sadness, right? So you know that if I run away from it, it is going to come catch up with me at some point or the other. I cannot keep avoiding it. And, mostly after trauma or any kind of bad experiences, we do tend to be avoidant. So avoidance is not your solution. You are going to have to face the situation because it is going to catch up with you at some point. What this practice helps over time, just practicing and practicing and practicing, you build up the resilience to stay in the moment and just see what happens. That's what we're doing, is seeing what happens. And this seeing what happens is something that's called the Zen mind, the beginner's mind. And what the Zen mind, the beginner's mind, is that you approach every moment as if it's the first time you're seeing it. So you approach every experience with a lot of curiosity, right? So in mindfulness, mostly, like, it all starts with bring your attention to your breath. And you're like, yeah, okay, now what, right? Bring your attention to the next breath. You do that, now what? To the next, and so on and so forth. And then you're just like, what's the point of this? I have brought my attention to maybe 10 breaths. Now I know what it feels like for it to go in and come out. And whatever, maybe I feel the warmth, maybe I feel the sensation of like the friction of the airflow. I felt it all. Okay, I have experienced it. Now, what do I do? Right? So when you're I'm kind of struggling to sort of, put this into words right now. So bear with me. But basically, when you approach every breath as new, you're going to forget your conclusions about the breath that came before it. So you're going to forget, was it hot or cold? You're going to forget what it felt like. Was it deep enough or not deep enough? But you're going to look at this breath as if it's the first breath of your life all over again, right? Because they say that every snowflake is unique. And just like that, they say that every breath is also unique if you look at it from a Zen mind or a beginner's mind. I feel like I've been talking nonstop for quite some time. Does anyone have any questions or anything to interject right now before I go into the next topic? Okay, I'm going to take that as a no. Thank you. Thanks. I was a little nervous. I'm going to admit it. So Ranita saying I'm great, and that means a lot. So I'm going to talk about the foundations of mindfulness. Okay, so now we're going to come into this practice. We're learning about what is mindfulness. We learned about the effect it has on my experiences to be judgmental versus to be non-judgmental. And now I have decided मैं label नहीं करने वाली अपने emotions. I'm not going to look at things as good or bad, and I'm not going on this classification spree. I'm just observing. All right, let me tell you more about what are the qualities or the emotions maybe you should approach your mindfulness practice with. So the first is patience, right? So patience involves letting life unfold on its own time. And I've written this down here. It's patience is being okay to step out of the driver's seat, right? We're all so control oriented. Like, I want to decide what I do from the minute I get up to the minute I go to bed, and the second something goes not according to plan, that's when I flip, right? So it's patience is going to teach you that it's okay. I don't have to be, the pilot of my life. Let it run on autopilot for a few seconds, or let it take charge the way it wants to. You may try to control every aspect of everything, but there are still going to be so many factors completely out of your control. So patience is learning to be okay with it, right? So in meditation, when you sit down for your meditation, how this mindfulness comes in is you're learning to sit with discomfort. It's not easy to sit in one position for, I could do it for 2 minutes when I started. Sorry, I had a question. Can we talk about empathy fatigue? With everything going on in the world currently, you can't help but get emotionally invested. How to not let it get to you? So it is not possible to not get emotionally invested. You're going to look at how everything is affecting people around you, and it is going to take a toll on you. And I feel not letting it get to you is something that you do develop with practice. It takes time, but what you're trying to do is you try to approach the situation with compassion, right? So I can answer this, in terms of what I would do is, I understand that there's a lot going on in the world currently. But what I also understand is, in my power, there's only so much I can do. So I have immense empathy for everybody, but I'm tired of it, right? Is what I think Neha is saying. So maybe I can start with getting some sense of control, which would be by doing whatever I can do, which is in my power. So maybe, I know I can give compassion to people who are suffering. I know if I can make donations which are in my power, I would go ahead and do that. If there is some quality I'm equipped with that I can share, I would go ahead and do that. And to protect my own emotional investment in that, right? Maybe you meditate, and that's when you learn to disconnect yourself. It's again hard, but when you are approaching it with a space of non-judgment, so you're looking at it, but you're not trying to judge everything as maybe good or bad, which is very hard given that in the current world there's lives being lost, there's people making decisions, everyone has an opinion about what that decision is like. So cutting off, right? I want to take a break from that. I want to step away. I want to take a deep breath and not be in that world right now. I want to be anchored with my breath. I want to breathe. I want to focus on what's happening in my body. I want to focus on what are the sensations that are arising when I'm thinking certain things. And I want to think about self-care. I want to think about what is it that I need right now? What is it that I can do for myself right now? Once I have all of that covered, once I feel a little grounded, once I feel like I have taken care of myself enough to be, my cup is full enough for it to pour for someone else, is when maybe I can start doing, there are these heart practices that involve loving kindness and compassion meditation, and all of these practices which sort of involve, sending healing energy or just kindness out to people at large. And maybe within your circle, if there is someone, who is going through something, even something as much as listening to them is something you did that maybe might help you get your sense of power back, right? Does that help, Neha? Yeah. Because if you're not in a position to help yourself, you're not going to be able to help other people. You need to be strong enough first. So I'm gonna go ahead then. um yeah, JVN all the way. Yes, Vaishnavi. So, so initially in your practice, I'm going to come back to patience. Now, when we talk about patience and our practice, we're going to talk about sitting down, closing our eyes, and it's the hardest part, right? Starting is the hardest part for everyone. Is the hardest part for everyone. So when you're sitting, now I'm sitting. Initially, I remember I sat for maybe a minute or two, and I thought it had been a good 10-15 minutes, and I have accomplished so much, and it's time to go home. And I see everyone around me is still sitting put, and it can be a little daunting, right? That मेरे को तो लगा 2 मिनट में 15 मिनट हो गए, लोग घंटों घंटों बैठते, how are they doing that, right? So that sense can be a little overwhelming, and that's where your patience comes in. Is, it is to sit with discomfort, to sit with your mind chattering and all of that going on, and trying to still be patient with yourself and committing to what you're doing. Sometimes when you're in your practice, how to be patient. Yes, can I come to that when I'm talking about how we will be practicing mindfulness, and maybe that's a good time to take it. Okay, just remind me though in case I don't get to it. So sometimes in your practice, you're going to come up with a lot of intense emotions. There have been times when I have been practicing, or I've been guiding my parents or my friends in practice, and there is this dam that breaks, and there's tears and tears and tears, and it's hard, right? It's not easy to just let all of that grief out, or feel it and not be like, I'm done, this sucks, I'm not doing it again. So patience is giving yourself, like being patient with yourself, giving yourself that time, that, hey, listen, I know this is hard, I know this is not fun, but I have to do this because I will feel lighter, I will feel better, or it just will help me. And even if it doesn't help me, I have to do it because I cannot run away from it forever. So it's that patience that sort of comes with practice, because you cannot be sitting for your first ever mindfulness meditation, or any meditation for that matter, and be like, today I'm going to solve all my problems, everything is going to be great. How do you think your dietary austerity help with patience? Uh, I mean, think about it. If you're eating nice sattvic-ish food, you're not gonna wanna, you're not gonna feel a lot of acidity or discomfort, or you're not gonna wanna use the loo too much. It's going to reduce the interruptions in your practice. Is that relevant to your question, Vaishnavi?
Yeah, hi. Yeah, so what I wanted to know, yes, of course, all these things facilitate your meditation, but since we are talking about patience, like when you make that austerity like your lifestyle, it requires a lot of patience. So maybe I was thinking, can that patience be extrapolated to rest of the aspects of your life? Like you control yourself, you maintain a certain discipline, and then maybe we could use that in different situations in our lives. So is that like a safe place to start with, like to test your patience, or to actually build patience rather?
Um, Now, if you're asking me about the generalizability of, you're disciplining yourself when it comes to diet, or you're, being patient when it comes to making a certain choice, and if that patience you develop is going to translate to your practice, I say yes. But if your question is, if I want to start developing patience in mindfulness by developing patience in my dietary choices,
Yeah,
it
yeah.
may be a
That's
personal
what I want
choice.
to ask.
Yeah, it may be a personal choice, but I think a much easier way to do it would be to sit down, close your eyes, and practice mindfulness, like it
Right.
could
And
be a mix.
conversely, if you have already established that patience, suppose, like you've already gone on to that path, so is that an advantage in meditation? Like if you've seen that you're maintaining a certain dietary austerity, you think that can help like in mindfulness?
Yes, I do think so. Yeah. I mean, Shreya
Right.
can also talk about this more, but like in our yoga course, we have a whole section that talks about food and the qualities of different kinds of food on your emotional, mental, physical well-being, and your disposition. So,
Right.
yeah, I agree. Shreya, do you want to add something?
Yeah, I think if you starting off with having control on your diet, just to have patience in general in life, it can lead to something like you're being dependent on something to get something, which does not make sense. But of course, if you've gained that control on your diet, and then if you
Right.
want to think of it as an advantage to get patience
Yes.
in general in life, then you can do that. But
Yeah.
starting off wouldn't be the most ideal thing, I guess.
So you think meditation first and then you can have that. But if you already have that, then it's a plus.
Yeah,
Yes.
I think it's everyone's personal choice. What works
Can
for
I
you?
add to that?
Hmm,
Hello?
yeah, yeah, yes.
Yeah,
Yeah,
sure.
so yeah, I have actually done a diploma in yoga philosophy. So yeah, I think with yoga philosophy, what they say is certain kind of diet food, they have these hormonal issues in you. Like basically, they kind of increase the testosterone, they increase other kind of chemicals in your body, which could cause increase sexual. Libido, or increase in aggression and all of that. That is the whole idea behind dietary restriction if you're practicing yoga, because the more you restrict your diet to sattvic food, which is supposed to be neutral and will not result in rajas or tamas, that much more easier it will be for you to meditate. That was the whole idea behind having a sattvic diet.
Yes, yes.
Yeah, I think that's a fantastic way to put it, Nanita. Thank you.
Okay, Renita answered that brilliantly. I was a little double-minded about, should we go into the Rajasthamas aspect? Because she summed it up beautifully. So
Yeah.
thanks, Renee. Um, so patience, we're getting to the end of the section of patience now. So it is going to help you, like developing it will help you with not just the physical act of sitting, but also the act of sitting through tough emotions, intense emotions, and unpleasant sensations, which is very important. Um, Especially if you're doing this to address a few mental health issues or certain. Can you give me a second? Yeah, sorry, there was someone at my door. So yeah, I mean, especially when you're trying to address certain mental health issues, or you're trying to if you're engaging in mindfulness based stress reduction, or you're engaging in mindfulness based cognitive behavioral therapy, you're going to have to face those emotions, because that is the purpose of your practice. If the purpose of your practice is probably to work on improving your concentration or something, it may be initially okay for you to skip over those tougher parts, but patience is something you will develop with practice and practice alone. Next we come to trust. Trust in this is the trust in yourself, because we talked about our shoulds and musts, right? So people are always telling us how we should dress, how we should talk, what we should do, how we should behave. So everything is very ingrained by society, by parents, by our past experiences in the form of these shoulds and musts. And that's sort of what's caging us in, right? If these shoulds and musts go ahead to become your inner parent to you. So now you might be okay with taking that risk, but there is an inner parent in you that's going to pop up and be like, "Are you sure you should be doing that?" Right? And what that does, it sometimes suppresses the voice of your intuition, which is like your true sense of what you want to do, what you so to speak truly are, you know. So the trust in your intuition should, like with practice, you will learn to trust your intuition more than your parent complex, more than your shoulds and musts, which is going to help your true self like come forward. So trusting ourselves, reconnecting with ourselves as meaningful authority figures. Like you shouldn't want to have to take advice from your friends when you can if you want to. But the point being, I have a question from Saurabh. It talks about beards. I can't ignore it. What about practical constraints? Like management consultants can't grow beard. I can't. I want to, but I can't. Right. So I don't think growing beards comes in the realm of mindfulness meditation right now, in terms of what we're talking about. I would say practical constraints in terms of those, you either talk to your superiors, figure a way out, maybe you'll keep a very groomed beard, or you think about, do you really want to be a management consultant? Maybe you think about right. So you think about it, you decide if being a management consultant is more important to you, means more to you than a beard means, you know. With respect to patience, I have a hard time relating your question to patience. But I would talk more about I would talk about it more in terms of, you know, your inner voice, right? So I'll tell you this: they say that inside you there's three, probably more than three, but what I have heard or what I've been told is you have an inner child in you, you have the inner intuition or the inner you, like the me, and you have your parent complex. And most of the decisions we make, our defenses are your inner child, which is the rebel child. So someone screamed at you and your ego is hurt, and now you're gonna, you know, throw a hissy fit and scream back at them. That behavior is coming from your inner child. There's a parent complex, which we just discussed, all of your shoulds and musts, where, you know, if you were to think, I can't grow a beard, so I want to quit my job. I think if you sit down and try to listen, you should listen to your intuition, because both of the inner child and the parent complex have come from conditioning. While the parent complex is protective in nature, you do want to weigh the um, I'm blanking out on words. You want to weigh, you know, the importance of the outcomes in terms of, you know, my parent complex is telling me don't quit that job to go traveling, but my inner intuition is telling me I think I'm equipped enough to do that. If you weigh both of those and you don't see any logical fallacies in them, I think you should always go with your intuition. That's what you're always I mean, that's what I have been working on in therapy. In what I've been told is, you know, that what your shoulds and musts dictate, if you keep doing that, you are going to be unhappy in the long time, because it's not what you truly wanted, you know, if that makes sense. And if you keep running on your inner child or rebel child behavior at all times, that's also probably not what you want, which is why we often might lash out at people and then realize I shouldn't have said that, you know. So I hope that answers your question, Neha. Moving on, so we covered patience, we covered trust, and the most important part of the mindfulness practice, according to me, is non-judgment, not judging, right? When you are observing any experience, you want to be unbiased. You just want to have some distance and just be an unbiased observer. You're not, uh, they say in yoga, your mind is like a chattering monkey, and it's a chattering monkey on drugs, and it's a chattering monkey on drugs who's been bit by a scorpion. So, you know, that is the intensity at which your thoughts are jumping about and running, and like you constantly have this wandering, chattering mind of yours, right? So when you're sitting down for your mindfulness practice, you will notice that your mind wanders. You will notice that your thoughts are just going all the way, and before you know it, you're probably thinking of waterfalls, and it's not relevant to your practice. So instead of judging yourself or being angry with yourself that why I'm so bad at this mindfulness thing, I'm thinking of waterfalls, it is to be non-judgmental towards yourself also. So being non-judgmental towards the chattering of your mind, being non-judgmental towards your own shortcomings, whatever they may be according to you. So non-judgment is a very strong pillar of our accepting waterfall thoughts, is what Shreya just sent to me. So non-judging is one of the pillars of our practice. Also non-striving. So I don't want to sit in my practice striving to get to the Buddha state of mind. It's not about that. The more I try to not think of elephants, and now everybody is thinking of elephants. And if I told you don't think of Dumbo, you're definitely imagining those years, right? So the more you strive, it's practically counterproductive to your practice. So it's more effortless. You're accepting everything that's happening and just being in the present moment. Because now when you're striving, you're not in the present moment, you're goal oriented, you're future oriented. And all we want to do in mindfulness is be in this moment with everything it brings with it. And acceptance, right? That's the fifth and the last foundation of mindfulness, in which you just want to be with things as they are and accept them with compassion. So they say not every itch needs to be scratched, right? So not every emotion needs to be explored, not every thought needs to be explored, not everything you're feeling needs to be labeled. Just accepting things as they are and letting them be. You don't necessarily always have to let it go, as much as just let it be. Don't keep poking the bear, right? So those are our foundations. And coming to how you can practice, right? The easiest way to practice is to sit down, close your eyes. You don't even have to close your eyes if you don't want to. Maybe just leaving them soft, right? But what closing your eyes does is really helps cut out the visual distractions, makes your job easier in your practice. And one of the things that is integral, and one thing that you always have to anchor yourself is your breath. So just bring your attention to your breath. No matter how you're feeling, your breath is always there with you. So just bringing your attention to your breath, starting to notice your breath first, right? So you're noticing whether you're breathing from your belly or your chest. You're noticing the rhythm of your breathing. You're starting to notice how it feels when your lungs are full. You're starting to notice the temperature of the air coming in and out of your nostrils. So you're just really being invested in the present moment experience of your breath. And that's one way to start. So one practice could be simply only watching my breath for 1 minute. And if thoughts come, let them come and let them go. If thoughts come, let them come and sit there in that corner, but you don't have to engage with them. So that's one thing. And this is where I want to come back to Saurabh's question about, how do you develop patience? The simplest, most straightforward answer to that is with practice. It's only with practice that you develop patience. You're going to sit today for 1 minute. You will develop enough patience to sit for 1 minute. Tomorrow you will sit for 2 minutes. Then 5, then 10, maybe more, maybe not. But it is the patience ki mere ko bahut bore ho raha hai, but I'm not going to get up and go away, is your, it is a version of patience in your practice. And sort of it might turn into striving, right? At that point that you're sitting and you can feel your foot falling asleep, but right now you're going to not pay attention to that. But got to do what you got to do, and bring your attention to what is in the moment, right? Wherever your attention goes, your energy flows, is again another thing they say in the yoga mindfulness world. So and you start enjoying what you're doing, right? Like Renita said. So that's one way to incorporate patience. Another practice you can do is a body scan, and this is what I believe in a lot. I do a lot, and it's maybe one step more advanced, not advanced, but just one step further than breath awareness. Is where you sit down comfortably or you lay down. You don't have to put pressure on yourself for sitting cross-legged or something. You just lay down, close your eyes, start to be aware of your breath, because that really helps you cut off from all of the other distractions, because you're giving your mind something to do. So give your mind your breath and focus on that, and slowly start to do a body scan, right? So start with your toes, your feet, 1 foot at a time, your calf, your thighs, your glutes, your back, belly, until you're at your head, even your facial muscles. And when you're at every muscle, really notice it. So notice, is it tense? If it's tense, you can immediately just reflexively relax it. See if you feel any emotions there. They say that you tend to feel a lot of emotions you tend to store a lot of emotions in your glutes, in your quads for some reason. So in yoga, we find when we're doing hip openers, it can be a very emotional experience for a lot of people. I've been in so many hip opening classes, and I've seen everyone around me just crying left, right, and center. Some people just start to Jacobson and Laura Mitchell, the Jacobson's technique of like taking attention to your body part and then relaxing it. So you start to do the scan. And now when emotions come up, you don't have to label them as good or bad. You don't have to engage in them and try to think about, why is this sadness here? Where is this coming from? You're not engaging, you're just observing. And what happens is sometimes, intense sadness may come up. So you sit with it and you let it go. So you may cry. What else? You're going to feel like crap for a minute or two over there, but you're letting it out. And maybe in the next body scan, you're not going to feel as crappy when you get to that body part or that emotion again, because your sadness bucket was full, my friend. And now you've emptied it. Now you've given it, like another space to refill itself again. So you're not overflowing with emotion, with a sad emotion or a fearful emotion at that time. So when you encounter any emotions, any physical tightness, even, just relaxing it, taking care of it right then and there, and experiencing it in your practice. I think the body scan is a beautiful, beautiful practice. It has helped me immensely, and I recommend it to everybody. There's also a sustained attention practice, right? This is where you will take your attention on, it could be a beautiful painting, it could be a lava lamp, it could be a river, right? Like when you're out in nature and looking at a leaf. And now all you're doing is looking at the leaf and experiencing the leaf. That sustained attention practice is also beneficial in your mindfulness practice. There are informal ways of practicing. So this was a formal practice. I do have, I've written down like this one way of working through a mindfulness session. And I can get to it if people are interested more towards the end, because it's extra. But when it's part of our formal practices. As part of your informal practice, it could be as simple as washing your hands. We're all washing our hands a million times now, right? So really being present in the act of washing your hands. So you put the tap on, you wet your hands, now you've taken the hand wash, now you're really feeling the sensation of the hand wash, feeling the sensations of your foaming, really looking at your hands, really washing, front and back and sides and fingers and everything. And in those 20 seconds, you're completely present in those 20 seconds. That also is a mindfulness practice. One very, very popular mindfulness informal practice is a walking meditation. All you do is walk, right? But you now break down this experience to be a more mindful, engaging experience for you. So you're walking, but your attention is really on, you put 1 foot on the ground, you feel the weight shifting, you feel your foot going off, you're feeling the rebound of the carpet under your foot or the tile under your foot, and the sensation of walking, what it's doing to the rest of your legs, what it's doing to your body. So you're really in the moment, you're really in the action of walking, and that also is a mindfulness practice. And you could generalize it to anything. Brushing, we brush every single morning, so just the act of brushing can also be a mindfulness practice for you. So those are the practices. And I can talk about the application in pediatrics and youth, but I'm going to do that later. Imagery is a form of mindfulness, more in the sense that, like, I would and wouldn't classify imagery as mindfulness, right? So I am not imagery for athletes, yeah. But again, you realize when you're doing imagery, you're not in the present moment. You are in this imagined visualization. That's where you're living. That's where your mind is at. That's where your awareness is at. And that's why I hesitate to include imagery in mindfulness, but I would include imagery under the umbrella of meditation. I would write. Is that making sense, or should I elaborate more, Vaishnavi? Okay, great. Because mindfulness is all about being right here, right now, no distractions. Summing it up like in the most basic way, and imagery would take away from that. I'm going to let Shreya take over. I will touch on the pediatrics application of it maybe towards the end, because I know not a lot of people here are peds people. So all my peds kids can wait with me towards the end and we'll talk about it.
Okay. So thank you, Tanvi, for telling us everything about mindfulness and how we can practice it. Um, Go peds. Anyway, so I am going to talk first about what happens in your brain. What happens in your brain when you're practicing mindfulness, and then move on to chronic pain, particularly because it's more effective in chronic pain, and then just brush up a little about recent literature. Okay, so sorry, just a minute. Yeah, you need to know that mindfulness, so basically pain is related with nervous system. Okay, one. Second thing is you can change the nervous system, and therefore you can change pain, right? Now, there are about 2 or 3 major regions in the brain which are getting affected when you're practicing mindfulness. One is the DMN, the default mode network. Let's also call it the monkey mind. Okay, so when you're thinking about the past or the future, which we all do, we are humans, it's okay to do that. Your DMN gets activated, right? Now, the whole point of this is that you can think about, going from Mumbai to Kerala when you're thinking. But the whole point of mindfulness is stop at Goa. You don't have to go all the way to Kerala. You stop at Goa so that it's easier for you to go back to Mumbai, right? If that makes sense. The other thing is your amygdala. Now, there's a little lesser research, if I'd say, with respect to that. I'll come back to that later. But it said that if you practice mindfulness, your amygdala kind of shrinks. Okay. Now, when it shrinks, the prefrontal cortex is getting denser and thicker, which means you're more, motivated, and you're more aware of what is happening at the moment, and not thinking about the past and the. Just a minute. So, what I mean by shrinks is it's less activated, if that makes sense. Yeah. No ways. Huh. So it's kind of less activated. Okay. No, 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 not anatomically, but it's just less activated. So don't worry about that. Um, so your prefrontal cortex is more activated, if that makes sense. And you're more aware and motivated to be in the present moment, right? Now, these are the 2 or 3 major regions that are affected in the brain, and that's what we want with mindfulness. When we were talking about patience, mindfulness is about being in the present moment. So I understand it can be difficult to be patient about everything. It's like someone who's gone through a breakup and you're telling him, koi nahi yaar, koi aur mil jayegi. That does not really make sense. But if you're not patient, think about the effects of impatience. Okay, what is going to happen if I'm impatient? What is going to happen if I think I will get coronavirus? Will I actually get it, or is it only going to make it worse? So try to, think about the effects. If you're being impatient, think about the effects of being impatient. Fear setting exercise. What do you mean by that, Saurabh? Sorry. Okay. So, mindfulness is all about increasing the activity of, uh, reducing the activity of default mode network and increasing your prefrontal activity of your prefrontal cortex, right? So, I'll give you an example of maybe using the oven. I once burnt my hand when, like my palm when I was using it. And ever since then, I'm really scared to use it. And I'm being judgmental about it. Like Tanvi said, the whole practice of mindfulness is to not be judgmental. But I'm being judgmental by thinking that I don't know how to use the oven, which I know is not true. But I am still scared to use it. I always call for my flatmates to, remove the tray from the oven. And in spite of practicing mindfulness, I still do that. So yes, you need to be very patient when you're doing it, when you're practicing mindfulness. With respect to chronic pain, um, let's say you get a patient who's had, yes, it's not instant noodles. You really need to be patient. Um, so let's say you have a patient who has had a road traffic accident about 4 months ago, and he has pain in his right trapezius. Okay. Now, when he goes down to get his groceries, he knows that if he is walking with all those grocery bags for 10 minutes, he's going to start having pain. So, just out of fear, he does not do it, even if right now he needs to do it and get all his groceries at one go. He still does not do it because of the pain, because he thinks he has that memory of pain, which he thinks is going to come back in about 10 minutes. Okay. And he comes to you at the clinic and you're giving him exercises, say some strengthening exercises, and using your resistance bands. And in 10 minutes, he says that, okay, I'm going to have pain now, I'm going to stop. And he tells you, he automatically stops every session after 10 minutes, even though his strength is actually increasing. That is just because he's not aware in the moment and he's thinking of his pain memory that he has. So when you're dealing with chronic pain patients, you need to tell them that, okay, be in the moment. And I know, easier said than done, but when he's exercising, ask him how are his muscles feeling? Does he have pain in any of the muscles? Um, can he move on from, doing 10 times to 20 times maybe? So speak about the exercise he's doing, maybe about the muscles that are getting activated or strengthened when he's doing the exercises, right? We've spoken of the benefits of, yes, it kind of does. You can, so mindfulness is actually a third wave intervention, okay? So you cannot just do that and say not do ACT, acceptance and commitment therapy. You have to mix a few things and try to get the result. Just like when you're practicing physiotherapy only, you're not doing only MFR and asking the patient to go. You're teaching him postural, you're giving him postural advice also, and some isometrics maybe. So the same goes with psychological interventions. You can't just stick to mindfulness and let that be. You have to include ACT also, which I'll come back in a bit. Are there any other questions with respect to chronic pain and mindfulness? Because I'm now moving onwards to the contraindications. Okay, I'll move on to contraindications then. Yes. Could you elaborate a bit more on body awareness? So let's say if I am doing shoulder strengthening and I'm not sure that which muscle I'm actually training and what is happening in my muscle. That is a part of patient education, but at the same time, if I'm just blindly doing it, maybe thinking about what I'm going to have for dinner and doing my strength training, it does not make sense because I need to know what I'm doing. how many counts I'm doing, which muscle I'm actually training, if I'm actually training the right kind of muscle. So it is about being in the present moment without any judgment. If I did maybe 10 push-ups yesterday and I can only do 5 today, that is okay. Okay, so you need to be aware of, yes, please, Tanvi. Mm,
So, in terms of the pain and activity, I think it's also important to understand that your present moment experience is beyond pain. That's the bottom line. That what pain you're experiencing is not the only reality of this present moment. There is more happening. So, maybe you can redirect them to, okay, maybe focus on your posture. Can you look at the mirror? Is it hot? Is it cold? Is it like in whatever different ways you could redirect them, maybe give them a break, right? And now when you give them a break, talk about anything but their pain. Talk about how well they did. Talk about how talk about their outfit, I don't know, right? So basically it's more about redirecting and understanding that this present moment is made of more than just the pain experience. My pain is not the only reality of me. There is more to this moment than that. And maybe then focusing on that, focusing on, like she said, is my muscle activating right? What do I see in my posture? Am I doing this correctly? Am I heavier than I was before? So all of those things can also add to your understanding of the present moment. Yeah.
yeah, makes sense. Thank you. Okay.
Also,
Hmm.
sorry, I am sorry to interrupt. Yeah, but I think a lot of clinicians also work on the environment in which they practice. Like I was listening to one of the speakers at the Pain Science Summit, the San Diego Summit, and she just showed a picture of the waiting lobby, which is otherwise very mundane or very depressing for most patients because they're already probably experiencing chronic pain and are waiting to be attended. So what she's done it, that she's used really mellow colors and made it very cafe-like or house-like, so that they feel, they feel a little at home or at ease, if you may. So does this also help? Because now with mindfulness, with what Tanvi mentioned, we are closing our eyes, so we are actually shutting the usual input. But do you think it matters, the background or where we are and the kind of surroundings? Do they
It,
influence
yeah, it
our
definitely matters. And when when Tanvi said that you need to close your eyes, mindfulness is not just about closing your eyes and concentrating on your breathing. It also includes, now, for example, when you say about, the visual cues, if there are patients who are exercising, I often ask them to think about the next, of course, that does not make sense now, but earlier I used to ask them, about which trip they're going to take next, or where did they go for their previous trip, and if it was a beach, for example, then where was the accommodation right in front of the beach. So I make them go back to their trip which they actually enjoyed, and then in their mind they're actually thinking about a happy moment. So that is kind of giving them a distraction. They are in a happy moment, and it allows them to forget about their pain for a bit and actually exercise. Now, I know mindfulness is all about being in the present, but with chronic pain, you have to kind of, give some other dependency to them, or, for that very moment, give them something good to think about so that they're forgetting about their pain. Does that make sense, Vaishnavi?
oh yes it does.
Okay, all right. So I'm going to, okay, explain. Yes, the mind does have an episode on mindfulness. It's about a 20-25 minutes episode, so you can definitely check that out. Okay, so I will talk about the contraindications now. We know about the benefits of mindfulness, how to practice it, how we can apply it to physiotherapy, but there are some contraindications to it, and you need to be really careful when you're actually suggesting it to a patient. Okay, so usually patients with chronic pain like they have a lot of anxiety or depression. that just comes along with it, because a patient who has had pain for months will definitely be frustrated of it, that okay, I really need to get rid of this pain, because something as basic as lifting heavy grocery bags is something that they cannot do because of their trapezius pain. So they will have anxiety and depression. So when you're recommending it to patients, try to understand their personality. Okay, if just telling someone who's depressed that just accept whatever thoughts you're having and you will be okay does not really make sense for them. Or if someone who is alcohol dependent or has psychosis, for them I would really suggest that you make them do it in your presence, or ask them to enroll in a certain group or a camp where they can practice it, and then make it a lifestyle. Or someone who's suicidal, even for them, yes, someone who's suicidal, for them also it is kind of difficult for them to practice it on their own, because let's say they're thinking something, and if they start accepting it, you don't know what might end up having, like what they might end up doing. So with patients who have mental health issues, ask them what kind of medication they are taking, if they are taking any medicines which are helping them with that kind of behavior or the thoughts that they're having. A lot of times people have thoughts that they are not actually ready to deal with, and they are very strong emotions. So really understanding your patient, the personality, what kind of an attitude they have when they come to your clinic is really important, because if you ask them to just practice mindfulness and deal with the kind of thoughts they're having, it can get difficult, because maybe the patient is not ready to deal with those kind of thoughts right now, right? In the UK, with depression, I know there are patients who, get treated for like situation dependent. So if there is a situation that is making them feel a certain way, you work on the situation first and then move on to the other aspects, right? Like I mentioned, mindfulness is a third way of intervention. So doing it on its own will not help you. Let's take an example for right now, ACT. Okay, so okay, fine, they've accepted that they have pain, but they also need to commit to kind of eliminate the avoidance behavior that they have. Like for example, if walking and lifting bags for 10 minutes is giving them pain, they need to eliminate that thought and instead bring a positive thought that okay, I am going to maybe take breaks in between, if that 10 minutes is going to give me break or give me pain, or just stop thinking about what is going to happen in the future or what is going to happen after 10 minutes, right? So before recommending it, I would really suggest first you do it. Now when you're doing it, don't have any sort of an expectation that okay, no, mindfulness se ye hona hi chahiye and I should feel at peace. No, it is not necessary that you will feel that today itself. Okay, so don't have that expectation that I am going to feel good, or this is the kind of result that I should get. It is not necessary that you'll actually get it. If you do, then it's great, but don't put pressure on yourself. There are a lot of apps that you can use, like Calm and Headspace. Even when you YouTube, there are guided meditations which you might come across. So you can do those. With respect to eligibility, okay, a lot of you might have that question, if are we even eligible to practice this? A lot of times, if you're working in a multidisciplinary clinic or hospital, then you do have access to psychologists who can, who your patients can get in touch with. But if not, and if you are trained in it, if you're reading up on it, you can ask the patient to practice it, at least, if not at home, then at least in your presence, right? Tanvi and I did our teacher training course at the Yoga Institute in Mumbai. They have a lot of locations in India, so you can look about it on the internet. So we are partially trained, I'd say, Tanvi, I think. Yeah. So we are partially trained to practice it. and there are some, mindfulness and meditation camps as well. So you can do that. So if you know about it, you are allowed to practice it. So don't think, who are you to actually make patients do this? Just keep one thing in mind that uh, you practice it before recommending it to anyone. Okay. Is there anything you want to add, Tanvi? There's just one last bit that I need to say then.
Yeah, I think in terms of practice, in terms of doing this with your patients or for your patients, I don't think there's any hoops to jump through. At least in India, you could do this even without having any qualification, as long as you know about it, right? We can practice whatever we want as long as we've got working and foundational knowledge about it. So when you practice, that automatically does make you eligible to teach other people, because you will experience it, and the more you practice, you will have doubts about the practice. The more you practice, you will have stories to go back to. Like, I learned that I should not practice for hours and hours and on end when I'm just starting out, because it's going to wreak havoc with your system, and you learn it when you practice. Like, initially you're so excited to practice, right? So you're like, aaj main aadha ghanta karungi, and you've not done it for a single minute in your life, and then you realize that half an hour was so tough that you probably will swear off the practice. So a good rule of thumb is to ease yourself into the practice, ease your patients into the practice, and really see if they are like, if someone has active mental health issues. It does not automatically disqualify them, but you can have a word with their provider, right? You can get in touch with their therapist with their permission and tell them that this is something that you are planning to introduce into their treatment plan as part of chronic pain, and you will be just maybe for a minute or two, maybe start off with some guided imagery. It's not mindfulness, but it's meditation, and what that will do is it will help develop my sitting tolerance to be able to do mindfulness practice independently. At least I'm getting used to closing my eyes and sitting here and noticing my breath, because someone on that audio is asking me to do that, and that also is a good gateway to start practicing.
Okay. There's just one last bit that if you're reading any articles or recent literature, just keep one thing in mind that the studies about it are still in its infancy. One, there will be terms used like mindfulness-based intervention or mindfulness-based cognitive intervention. The latter is an older term that is being used. Another thing is there are a lot of articles uh, about, if it's an RCT, one of them is getting mindfulness and the other one is a passive control group. So make sure the other one is also getting some form of therapy to actually understand if it's working out or not, because there are studies where the other group has been kept passive and there's no other intervention that is being done. The last thing is see what definition are the authors using for mindfulness, because there are a lot of different mindfulness. They might combine it with ACT or something else which you are not maybe looking for. So see what kind of definition they are using. If it's a quantitative study where the participants are self-reporting, are the patients actually understanding, are the participants actually understanding the questions? So look out for such loopholes, because there will be a lot. Just coming back to what Ove said about shrinking, it is I just missed out on one point, that I was just looking at the pain summit, and I think it's Neil Pearson, yes. He puts out this question, and there is no actual study which has actually stated that if we are practicing mindfulness, it's said that the amygdala kind of reduces its activity, and yes, am I right? Yes, amygdala kind of reduces the activity, but he is like, uh, is the activity already reduced in the people who are attracted to yoga and mindfulness? For example, Tanvi and I did the course, and we went ahead and did it. Was the activity already reduced in us? Were we already anxious, which made us go and do it? Or is the practice actually increasing our the capacity or the activity of the prefrontal cortex? So there is a lot of research that is lacking in this aspect. So read up on it, practice it, and then recommend it. Yeah. Mm. Okay. And Tanvi,
There's a question.
is there any literature supporting? I haven't come across any with migraines and headaches.
I think I read one. I haven't read it. I was just doing this quick search, and I think I did find one that talked about headaches. I did not go in and actually go through it to tell you if it was supporting it or not, and if it was a good quality study or not. But I personally do think that it would be useful, because it works. Again, now this is not backed by evidence. This is not something I have seen in a research paper, so proceed with caution. um, but something you can do quickly to kill anxiety. We'll get to that, sort of. So with headaches, I think I read this somewhere, and I really cannot remember the source, is why I'm not so confident about it, but they say that it really helps in decreasing your inflammatory activities and inflammatory markers in your system. Now, I don't know if I read it in some random magazine kind of book, or if it was like a study that was done. So I don't know the rigor of it, but think about it, right? Like, it is found that it is helping when you are stressed, you release cortisol, and cortisol goes to your hippocampus, right? And it has been found that your increasing firing of cortisol does shrink anatomically, physically shrink your hippocampus area. They found that in these neuroimaging studies, right? And now if your hippocampus is getting shrunk, it is going to affect your memory, learning, emotional regulation, right? That's one aspect of it. So I mean, cortisol goes ahead and does a lot of things. And now what mindfulness or a meditative practice does is it really helps bring down your flight, fight, fight, amygdalic, like sympathetic reactions, right? And it's going to have an effect on your stress hormones. It is going to have an effect on stress, period. And that in turn is going to have an effect on your migraines and headaches, because you, again, this is anecdotal, but when you are stressed, you have more headaches. And you notice, and I have been noticing it especially now in this whole isolation situation, my head is blasting most of the time, and I'm just not even aware of it. I'm just like, I don't know when it started to hurt, but it's really bothering me. And maybe I'm engaging myself in something that's really interesting for me to do, or that's engaging me, and I'm not feeling anxious or sad anymore. And I notice my headache is gone because I'm not as stressed. Every time I look at the news, I have a headache, right? So again, anecdotal. It needs a lot of research, this whole thing, it does. But I do think it would be useful for headaches, migraines, pain of any kind. What can you do to quickly kill anxiety? um, I think what helped me was a body scan. It does nothing can quickly kill anxiety, as far as I know. If it does, then I haven't been blessed with that information. But when you do a body scan, you become very quickly aware of where is this anxiety in your body. It's anxiety is such an abstract term. It's not sitting in like my left head. Either anxiety here, I can't do that, right? It is somewhere. It's so abstract. I'm just feeling it. So locating it in your body can help. So the body scan comes into the play here. And once I locate it, I have to have that patience that we talked about, to let it play itself out, and be non-judgmental, not get entangled in those thoughts, and just observe it and then let it be. And that could come in helpful, for anxious episodes.
Yeah. For me, a lot of times, visualizing something helps. So if you like climbing mountains, or that 22,000 feet, was it sort of? So think about that how amazing it was to actually climb it. I think of beaches and the sound of the waves, which actually reduces my anxiety. So try to figure out what's working out for you. For a lot of people, just deep breaths work. For Tanvi, body scans work. For me, ocean waves, the sound of the ocean waves work. So it really, you can kill anxiety. Like if you notice yourself getting worried about what if you get corona, you know that this is going to lead to anxiety. So immediately take a deep breath, know that you've taken all your precautions, and think of something happy if that helps you, that is. So you can kill it momentarily, but if you want a long-term effect, you might want to get into practicing mindfulness or anything that helps you every day for a long-term effect.
Another thing that comes in helpful is like anxiety is essentially you're worrying, right? You're in the future. You're like, kya hoga, kya hoga, kya hoga? Oh shit, oh shit, oh shit. And now you have lost all control. So what also helps is really rooting yourself in the present moment. I think I've read this a lot of times. A lot of the therapists have told me is that look at 5 things around you. So just scan your room, look at things around you, and then like notice one color and then try to find 3 more things of that color in your room. So what you're doing is you are telling yourself whatever you're thinking about is future tense. Present tense mein kuch problem nahi hai tumko. Like present tense, all of your dreams and fears are not coming true. So you are allowed to take a breath, allowed to take a break, so that also could come in handy, like just grounding yourself in the present moment. Yeah, the 5 senses technique. Okay.
Okay, I am done. Tanvi, is there anything you want to add on?
Yeah, I was just going to go over the PEDS aspect of it. Not very lengthy, also not very research based. Don't scream at me, people. I tried. Most of the studies were not of great quality, but there weren't even too many studies because this is so nascent. It's still coming up. So I think it's going to take us a long time for us to really do those rigorous researches and find out what works and what doesn't work. But now what it does, right? What does mindfulness do for you is it helps your attention, it helps your emotional regulation, it helps your anxiety, it helps develop a positive affect, it's helping your self-concept and improving your executive functions. And when you go to see, now think of all of our kids on the spectrum, our little kids with ADHD, all of these like 3-year-old, 5-year-olds coming in with, like so much issues in terms of their executive functions, in terms of their attention, in terms of their not motor function, some of them motor function also, attention deficit. So all of these guys coming in, they could definitely benefit from it, right? Think of any ASD kid that you know of, and just emotional regulation. If he had the ability to learn to emotionally regulate himself, that would go such a long way in helping him, right? Because that's what we do in SI, don't we? We work on self-regulation in SI as a primary method. That's what we're trying to do, is get him to be a little more regulated in the moment so that he can focus on activities. So for me, regulation comes first and function comes after, because only if that child is not freaking out is he going to be able to do that puzzle. So studies have found that a mindfulness practice can help kids on the ASD spectrum with self-regulation. They found a sustained attention meditation where we talked about, really concentrating on one point can help increase the use of your prefrontal cortex, right? In kids with ADHD. Now, when you increase the use of your prefrontal cortex, your brain is going to form more neural pathways, and you are going to start using your prefrontal cortex more, and that's going to help improve your attention span. I have worked with kids with ADHD, and I have found improvement. We used to initially do a lot of heavy work because they did have, like balance goals, and they had a lot of gross motor goals where they were all for some reason very hypotonic. So we've done a lot of heavy work, which has definitely helped. But what we did after, now a lot of these ADHD kids that I saw were 3-year-olds, 4-year-olds, a lot of them with cognitive delays. So if I tell them, sit down, focus on your breath, they're going to zoom out on me like nothing you've ever seen, right? So what helps is, we used to make these lava lamps, or we used to buy them. We used to have some or the other sort of a visual stim toy, and we'd use those, a very gentle visual stimulus, a slow visual stimulus, which comes into the realm of SI. But what it's doing is the same, is that your child is now focusing on that more. We used to play games which required them, like if it's an older child, I would play find the difference, spot the difference kind of things, where they really have to focus on just the 4 corners of their paper and try to do something. And over time, we did have, like, we used to have goals, right? Like, he will sustain attention on one activity for 20 seconds, 30 seconds to begin with, depending on how they are doing at baseline. And we did find that the kids were meeting these goals by doing these things. With our kids with CP, there is a study that found an effect of mindfulness on spasticity, but this was in adult spasticity post-stroke. But I am not sure if it's generalizable, but what I have seen is, again, in my practice, when we did have kids with CP, older kids, right now I'm talking like 10 and up, who will understand when I'm trying to get them to close their eyes and do this guided meditation with me, is that they would have, they reported better quality of life. So just imagine the amount of stress all of these kiddos are going through. Imagine the kind of, cortisol being released in their system. Like, it's intense up there, right? And they come in and constantly struggling to do the most basic things people around them are doing. And we talked, right? I talked with a few of these kids about like their experiences at school, if they were not in a special able curriculum, and how they coped. And a lot of them had issues that they were struggling with, right? They all felt inadequate, they all felt um, upset in some way or the other, and that was causing a lot of stress. But and then what we started to do is the last 10 minutes of every single session would end in this guided meditation. Everyone would close their eyes and listen to my voice and just breathe deeply and try to relax. And what that did is, at least in that moment, at least for the next 5 or 10 minutes while the child is still there, I did notice an improvement in their tone, because they do have spasticity, they do have increased tone, which is pathological, but also physiologically, because of habit, because of mujhe walker leke chalna hai, crutches leke chalna hai, my posture, the struggle I'm anticipating later, they do reflexively tend to tighten them more, right? So at least that tone was released, and over time you do start to notice some improvement in their posture, some improvement in their tone. Very anecdotal, guys. Again, I cannot stress on this enough. There are not a lot of studies on this, and if you do find something that is of good rigor, please do send it forward to us. But yeah, it helps there. Think about your teenagers right now. They're not even kids with any disabilities or problems who come to us, but imagine doing a mindfulness based session in schools, right, for these kids, where you're already equipping them with the strategies that they will need in the future when things do get real, right? So imagine someone already knows that, oh, if I get angry, I could count to 10 and take deep breaths, and maybe I won't, be angry anymore, maybe I'll feel a little calm. And teaching the kids that being sad is not wrong, being angry is not wrong, being angry is just that, being angry, right? So just education in that environment would go such a long way in creating more well adjusted grown-ups, right, in the future. So that's one application of this in peds. I have religiously used it, like with all of my kids. I'm like, listen, come here, we're gonna sit down, we're gonna close our eyes, I'm gonna put some music on, because I know you're gonna have trouble focusing. So what you do when you put on some background music, when you like, a lot of these are SI principles, right? When I'm gonna have slow music, I'm gonna have a very soft demeanor of my own. What that does, it automatically is going to calm my child down to a certain extent. Now, when I'm playing music and I'm talking, his brain is not going to be chattering that much, because his brain has two things to do. You listen to the music and you listen to me, and you pay attention to your body and your breath and everything that I'm guiding you through. So now his brain is split into three things to do, and it's so busy doing that. The chances of him thinking about, ye meditation khatam ho gaya, I have to get up and get into that walker and walk to my car, and that's going to be a struggle, is not on his mind at that point. At least that's the feedback we've received over time with doing this. So that's something that you could all if you do work in a peace setup, you can try to use this and give me feedback, tell me how that worked. So yeah, I think we're pretty much done. We're done with the content that we did have prepared for this. If you guys have questions, if you guys want me to go through the sequence of how you could do a self-care individual mindfulness meditation session, you can ask me, and you guys could stay for that. And any questions? If you have questions, please ask. Yeah. Shreya, you could just say that you're unmuted. Oh, if there's anything, Vaishnavi just washed her hands. I hope you did it very mindfully. How was the soap? Did it feel soft, the foam? Good on you. So yeah, I mean, if you have any questions, anything to add, just anything you want to share, any of your experiences, please just unmute yourself and go ahead and ask. Even if you do want me to continue, please ask. I'm not going to do that otherwise, because I think we've had a long enough session anyway. Okay, looks like we're good.
Hi. You can hear me, Tanvi?
Yeah.
Yes.
Yeah. Okay. So I was just gonna say, since you were talking about research for headache and stuff and how meditation helps, I think I could help you with that. I know someone who is into meditation, but this is not going to be regarding to mindfulness. It's going to be meditation in general. And if you guys want to read about that, I will try to get it from him and pass it on to you guys.
Yeah. Yes. Anyone else have anything to add?
Well, if I think no one else has anything to add, I think we can stop the recording here, and then like if you guys want to continue discussing, we can do that. So thank you everyone for like joining in. Thank you so much, Tanvi, Shreya, for taking your time and doing this. That was really interesting. That was fun. So yeah, thank you. I'm just